we are hyper-focusing on regulating that nervous system, and it creates this fertile soil. Once you go and do physical therapy, occupational therapy, the brain and body are ready to receive it.
What's up, everybody? Welcome back to another episode of Therapy Unmasked here at Ability Innovations. Today is a really cool episode because we have a chiropractor with us. His name is Dr. Doug, and he's going to tell us a little bit about his practice and what he does.
Dr. Doug?
Thank you. Yes, I'm super excited to be here. I've been looking for you guys for a long time, to be honest. Excited to integrate with you. I own Statera Chiropractic. We've been in Riverdale it'll actually be 8 years this week. As of tomorrow, it'll be 8 years. My specialty is neurology. It's nervous system regulation. We work a lot on vagus nerve, the balance between fight or flight, rest and digest nervous system. I started out as like a family practice, just seeing everyone, mom and dad and grandma and grandpa.
Doing all the cracking and popping.
Yes. Well, not exactly. Well, we can even get into that. So my technique is a little different. I don't do old school chiropractic. I've got that tool in my tool belt. There's a right time and a right place for it. But even for adults, I'm not doing a ton of popping and cracking. I usually use instrumentation work. Even the old school chiropractors that did the popping and cracking, we learned that it wasn't actually bones moving that actually made people get better. We've got imaging nowadays to show what happens when somebody gets adjusted. And it's always been the nervous system that has made people better. It's not bones moving around. So now, once we knew that, we just fine-tuned to the nervous system. Even how we adjust, how we measure is all about the nervous system. So I use more instrumentation work. It's just not 1950 anymore. There's more sophisticated methods to be able to take care of people.
Chiropractics of today is completely different.
It is. It's kind of a golden age. I thought I had brought my instrument, but it almost looks like it's a handheld device. It adjusts a lot faster than my hands could ever adjust. And it actually vibrates at a certain frequency. It vibrates or resonates at 64 hertz. Is actually the same frequency that a healthy vagus nerve should resonate at. So it's more about waking up the nervous system and retraining it so that it can actually balance between fight or flight, rest and digest. And so I started out even that way, seeing moms and dads and kids. And then I started to notice like there was way more of a need for specialized pediatric care, all this neurodivergence. And I felt like that was a very underserved population. The neurodivergence and neurodevelopmental diseases are rising in kids. And so I'm going to dive into this. And so I found all this research on it. I found people that had already specialized in it, and we dug deep. And so that is now our hyper specialty is autism, ADHD, neurodivergence of every nature. We like the tough cases. We like the kids that can't walk, can't talk, that are basically locked out of their world and their life. And that's what it's kind of transformed into in the last few years is more specialized pediatrics.
So working with these pediatric population, you've kind of shaped your whole practice towards that. Do you have a team of people that do all kinds of different things, or are they all like chiropractors that work with you?
It's just hyper specialized on chiropractic. That's why I need you guys, is because to be a practicing chiropractor in the state of Utah, I actually also have to be a board certified physical therapist. I will also tell you that the training we get in chiropractic school with physical therapy, and even enough to pass the boards, is so generic. It is not enough to treat these special populations. I do not do the modalities. I do not do the exercises because I know for a fact there are people like you that are just simply going to be better at it, but they need it. So we are hyper focusing on regulating that nervous system, and it creates this fertile soil for once you go and do physical therapy, occupational therapy, the brain and body are ready to receive it.
We can get them into that zone, then everything else seems to happen really well.
I've heard you use that before. I actually watched one of your podcasts and you couldn't have said it better. It is exactly a just right zone. And it's a spectrum between fight or flight, rest and digest. Right. If you're too far in fight or flight mode, you can't even engage with the world. You're panicking. Yeah. If you're too far into rest and digest, you're asleep. You can't do therapy if you are that cathartic or lethargic. If you're in that middle zone, it's play. And that's where kids learn. That's where kids develop. They've got to be there.
And they connect with their world so much better.
Yes.
So we see those things the same way. I think when I think about the families that come and see us and the parents that might be listening to this podcast, I would think that they would say, well, okay, what exactly does it look like when my kid would come into your clinic? What would they do with my kid? Because I have all these preconceived notions.
Totally. That's the first question I get from every family member, especially with little kids. Well, you're always worried that I'm going to take your newborn baby and crunch their neck up. No way. Never in a million years would we ever do that. And like I said, not even for adults. are we doing that? It's just not 1950 anymore. There's more sophisticated methods to take care of the nervous system without all the risk. It's really, really gentle. Even for the little kids, we have instrument work. There's an infant setting that I can use on literally brand newborn babies. So to put it in perspective, there's no children I care more for than my own kids. And right now I have an 8-month-old. And so I watched that birth happen, and the birth itself was quite stressful on her. Right. And so it was literally 5 minutes after, you better believe I had my hands on her, working on her to regulate that nervous system. Because if you can do it right there, you don't get these like ingrained tough neurological patterns. And so that's what people, if a kid's that young, like, what am I going to do to them? And there's really two methods. There's instrument work, which I'll usually show parents what the instrument feels like. I'll do it on their hand, and it's not much. It's just this little impulse. Yeah, it's not about like a concussive force, like I'm slamming on you. It's about speed and that vibrational frequency. It's physics used to our advantage. If I can put way more speed into it, I need a fraction of the force. And the instruments also make it so that it doesn't really matter if it's me adjusting or if it's my other doctors in there adjusting. It's reproducible between each person. It's the same pressure you use to check the ripeness of a tomato, basically. It's barely in at all, and it's just sustained contact. There's a little impulse sometimes, but it's no thrust at all. And it's, again, we're trying to move bones. We're trying to activate the nervous system in there. So it's super gentle. As a matter of fact, a lot of parents will work themselves up worried about how the adjustment's going to be. And then when I do the first adjustment, the most common response is like, that's it? That
seemed easy.
Yeah. It's maybe 2 minutes that they're in my office. So gentle, so light touch. No crunching them around. It's very, very safe.
And what about the kids that come in? Like I'm assuming you see kids of all ages, and they come in and they're probably scared because it's a different setting and you've got different tools and things that they've never really seen before. And then what happens after you start working on them? Do they have that same experience where like, oh,
yes,
they calm right down?
And you've nailed it, especially when you get those special populations. You get into the neurodivergence, and often they want their schedule and their life to be so predictable and rigid. They'll come into this new place and it's scary and it's new. And so usually I'll sit them down, look them eye to eye, just get to know them as a person. And that right there, like that breaks a ton of barriers. And then you show them the instruments. I'll show them on their hand what it's going to feel like. And once they see that, they're like, oh, it's not scary. This is okay. It's not scary at all. And for that population, they don't have to be a particular way, meaning like you can't get all of them to sit down. You can't get all of them to be still. I'll chase them around the office if I need to, but eventually they get to a point where the nervous system's regulated enough that we're friends, they're nice and calm, and then it's easy for them. They crave it a lot of the time.
That's what I was going to ask. Do you get to the point where they're craving it and they want to go see Dr. Doug?
Yes. Yeah. One of my favorite cases, we have a patient he had severe autism, almost nonverbal, like saying a few words, big digestive issues. And it was a few months into...
And those are all clues that you're looking for.
Oh, yes. Yeah. Like it's all this nervous system dysregulation, and it's all data points that come together to give us one cohesive story. He got about 3 weeks into care and he would say, Dr. Doug. That's it. And they actually live close to my office. And so he'd point at it as we'd go by, and it was like,
that's the one.
Yep. And
gotta go there.
You could start to see that they're like, oh, this is helping me. I'm feeling better. They start to crave it. It is a little tough in the first few visits, especially in those neurosensitive cases. Like they don't want touch, they don't want new people. But when they even start to feel that it's helping them, like they are your best buddy. Like they are up in your business in the funnest of ways. It's night and day.
That's so cool. I'm sure that we're piquing the interest of a lot of our listeners at home.
When it comes to chiropractors, parents may be a little bit weary about bringing their kids to a chiropractor. And I know like online, there's a lot of like, I call them like shock value chiropractors who do like very shocking content that makes people not want to go to a chiropractor. So what do you in your practice, what do you guys do to kind of ease parents and kids, and I guess the public and community as a whole, that like actually we're a safe thing that's like can be positive for you in your life?
Yeah, because you're exactly right. Like what you see online is like the big, flashy, scary movements.
They wrap the towel around their neck and pull.
Yeah, I'm not a fan. I'll be honest with you. That's
scary.
Yes, like
it probably gives you a bad name and a bad rap for your business.
Chiropractic's interesting. you can walk into a chiropractic office and have no idea like what's going to happen, what modality they use. Even amongst chiropractic techniques, there's about 300 different techniques. And a lot of them you'll walk in and it's not chiropractic, it's physical therapy, or they do diet. Like it's so varied. And so for us, it's all about education. My first visit, we never adjust anybody on first visit. I'm not going to just slap somebody on a table and just hope for the best and crunch on their ouchies. We're going to do a very detailed workup. People are going to be well informed before they ever start care. I even need to know if they're good candidates for care. So there's usually 4 diagnostic images and criteria we can use to figure out, is somebody even a good candidate for care? Are they better off doing physical therapy, occupational therapy, speech therapy? Like, I have to consider myself a portal of entry. And sometimes cases come in, they're just not mine. Like they need to go elsewhere. Let's send them to the best place. And so the first visit is to figure that out. Like, are they good candidates for care? If so, what is the game plan? And then educate on how we adjust the safety of it. The fact that, as like we talked about, how gentle it is, instrumentation work, not popping and crunching, so that before they even say yes to care, they know so well exactly what this all entails.
What to expect and everything. Okay.
Yeah. And I really like too, earlier you mentioned you do it on the child's hand just so they can see like it's not as scary.
Yeah, that is all the difference, because they really do get nervous first time. Again, it's a new place. The instrument itself is metal, and it's got handles almost like a syringe, like a needle. And so often these kids have been through the medical system and the injections, and they
see that and go,
yeah, exactly. And so you show it like it's actually where we actually make contact with the spine. It's squishy, it's soft. And so they see there's no needle there. They see it on their hand and like, oh, I can do this. This is no big deal.
Well, so at Ability Innovations, we focus a lot on helping kids reach developmental milestones as well as gross motor milestones through occupational therapy and physical therapy. As a chiropractor, how could you support kids who are maybe already receiving those services and maybe want a little bit extra help? Like, I know you mentioned the regulation aspect of that, but could you maybe speak to that a little bit more?
Totally. So it is the regulation aspect where I can help that boost further. So often what we'll see this, what we call a perfect storm. So early in life, when the nervous system is developing, there will be these repetitive stressors or traumas on the body. The low-hanging fruit, or the common thing to talk about, is birth trauma, right? Whether it's C-section, it's so often that doctors have to twist, turn, and pull to get baby out. They're doing their job, but it is stress on that upper neck in particular. Often things happen to them in utero, like there are stressful situations for mom, or maybe not the best chemistry that goes into their system. And so it's these repeat stressors when their nervous system is literally forming. And what happens is it ingrains or entrenches them into more of that fight or flight mode. So the vagus nerve, the very nerve that's supposed to calm your body down, is almost dormant much of the time. Yeah. And so they start life in that mode, in fight or flight mode. And so if you're in fight or flight mode, you're not in develop and learn mode. You're almost in instinct and animal mode. So you'll see just that alone will delay them. They won't meet their milestones. The brain will say, yes, I know we need to talk, but we're literally running from a tiger right now. So we're going to put that to the side. Let's survive first. And then when we're actually calm, we can actually develop the milestones. If we can get it to where the body can regulate and balance out and retrain to where it can actually do a rest and digest and go fight or flight when it should, then the body says, okay, we're safe, we're okay. We can go into play mode and actually learn, develop, and grow. And that's where it can kind of be this catalyst or this fertile soil of they're doing PT and OT, and we're either seeing things stall out or go slower than we expect as the practitioners. And if we can regulate that system, it'll be a catalyst to where they just take off.
So I kind of see it as like this fight or flight mode, the animal, or what we call like the primitive brain, when that's firing, and that becomes like a barrier to a kid being able to progress and being able to learn and grow. And if you're able to remove that barrier, then they can do things like physical therapy and occupational therapy and speech and all of those things. And even school, right? They can learn better at school. So how often do you feel like you need to be there to kind of help remove that barrier and train their system to function properly again?
That's a really good question, because it varies from person to person, and it varies a great deal. One person, they're so deeply ingrained into that pattern that we need like repeat stimulus pretty frequently early on.
Yeah, that's what I wondered.
Yeah. in my most intense cases, we are even seeing them twice a day for a while. But to put in that perspective, that's the type of person that it is like my severe nonverbal autism, can't walk, can't talk, basically locked out of their lives, locked out of their body. They're so like, they can't engage with the world. And so it needs to be this repeat stimulus to retrain. It's instead of moving a bone, it is literally rewiring their system. And if we have too much space in between, it'll just revert right back because that's what it's used to. Yeah. But that's how bodies are, right? We all have patterns and habits in our lives. If we don't give it this repeat stimulus, it just goes back to what it knows. But that's not forever. Eventually, we get to space it out more and more and more till their body can do it on its own. That's the whole point. Instead of this, it truly is like deeply entrenched retraining if you do it the right way with the right protocol. The idea is for the body to regulate on its own, to be its own chiropractor or its own healer. Bodies are amazing in that way, especially children's bodies. They're just so ready to heal. You just got to give it that right stimulus to get there. Now, I gave you the most extreme example, but there's a range anywhere in between there. We can see kids that only need it once a week, especially even initially, all the way up to that twice a day. But then we'll measure and remeasure and make sure we can taper down at the right place, right time for them.
So what I'm kind of seeing is that this could be like a symbiotic relationship that the parents might have between what you guys do and what we do, where you're helping create this fertile soil and then we're helping plant. What we do is kind of helping what you do, and what you do is kind of helping what we do. And we're all part of this village to help this family and this child. Like this could be something that that really pushes success forward at a lot quicker pace.
That's why I'm so excited to find you guys. I've been looking for you guys for a long time, because we'll also see where all the conditions for the nervous system are good. We'll scan them and everything's showing up that we're doing great, but we'll still see that they can't move their bodies the right way. And what that means is they need to intentionally move their bodies the right way. That's I don't do that.
That's like physical therapy and occupational therapy. Yeah.
And I would also say, I'm talking so much about the nervous system. I am convinced that you guys big time also work on the nervous system.
Oh, we do. Yeah.
100%. You have to but it's just from a different
angle.
Exactly. Yeah. If you can get them move, they've got to move. They've got to move, because what'll happen is if they move well, it'll send healthy signals up to their brain. Their brain will literally rewire. It'll change their brain chemistry and their brain anatomy, physiology, and then it'll send good signals back down. Mm-hmm. And so I'll create the fertile soil, but I'm not getting them moving and watching them moving and giving them a good protocol for it at home. And that's where you guys, I need you. Like that, it's so vital. It really is a symbiotic relationship.
For our parents that are listening, would you consider to be the perfect candidate for your services?
Where we see that it's usually the history that gives us insight to that. Okay. If they had that story of a bunch of stress on their body early in life, that traumatic birth early in life, if there was a lot of like big interventions, a lot of like physical trauma, emotional trauma, that is our story. That is our case right there, where we can help a ton. And it's just so often. And I also see it correlate so much with neurodivergence. We've actually done a lot of we've been watching this for a long time, not just our office, but all the chiropractors like us throughout the world. We found that in all of our neurodivergent cases, 80% of them have some sort of like severe or bigger birth trauma or something around that time that happened.
Life-altering kind of episode that happened.
And if that's the case, it just means that it shut down how that spine moves and how that nervous system works. And that's where we absolutely shine.
When I've seen kids like this, like I'm working with kids like this, that there's something that happens and it kind of halts their growth and what they're able to do. And, we need like a whole village of people that can address this from all different angles, from mental health to just, like what we do, but also what you do. And then doctors and nutritionists and all kinds of people that can help kind of mediate what's going on in this retraining process that the kid is going through. And, like progress is progress, but if we can quicken the progress, that leads to a child being able to have a much better quality of life than they would if they were still dealing with all of these issues.
You've nailed it. Like it really is a village. And I like this idea of like hyper specializing. These kids they've been through so much already. Like I want to get on a soapbox right now. Like we are in this interesting time in healthcare where we've gotten rid of all the communicable diseases and like measles we're doing okay with. And
People aren't dying as much from that.
Yeah, but what about these like chronic diseases? What about these neurodevelopmental diseases? They are skyrocketing. Is now 1 in 6 kids has a chronic disease. That is crazy to me.
In Utah, it's closer to 1 in 4.
That sounds right to me. Yeah. And you could even say like neurodivergent rates, we're higher than the national average. Yeah. I think national average is like 1 in 30 right now. I don't know where we are exactly in Utah, but we're higher than that. California is almost 1 in 12 now. But if you were to go back to the 1970s, it was like 1 in 10,000. So what is happening there's something happening. And I think the community you're speaking of is the answer. This is where these kids get to be in their life. They get to be with their family. They get to be able to actually engage and live instead of being stuck like they have been.
Well, the neat thing is our namesake is Ability Innovations. And that came from, let's focus on the ability of kids, but also find innovative ways to help address what's going on and to push those abilities further than they could alone. And that's why we exist. So we're so excited to be able to work with companies like yours and people like you that, you know, we can be part of the village and be part of what is best for the kids of tomorrow.
Likewise, once I met you guys, I've already had so many patients. I'm like ready to refer to you guys because they just need you. It's just time, and I've been looking for a long time. It's a little hard to trust that demographic with just anybody. They're special to me. I love them, and so it needs to be somebody that focuses on that to be able to treat them the right way.
And especially like the neurodiverse population in and of itself. There's a lot of people that work in that population, but there's not a lot that treat it like it's something to be I'm trying to search for the right word. It's something to be intrigued by. It's something to be curious by, because the actuality is there's a lot of people in the world today that have changed society because they have neurodivergence. Yeah. And so if they can learn to shape that neurodivergence to be their superpower, they can do so much more in the world. And that's kind of how we view it, is they're not always broken. We need to open some of those doors like we're talking about. We need to open the doors for them so they can really offer what they have to give to the world.
That's perfect, because that's exactly right. They look at the world in a different way. And if they are unleashed to be their true selves, then it's not a weakness. It is a superpower, because they get to innovate, right? But so often they are locked away from the world. They've got all this dysregulation. They are emotionally distressed. Digestion doesn't work the right way. They can't move the right way. That's what I want to work on. Like, I'm not sitting here saying that chiropractic cures autism or ADHD. It actually doesn't even make sense to say that. I only work on the nervous system. I don't treat any one condition. I just work on the nervous system. But if you do that, it's not like autism goes away, but they get to now be their best selves. They get to engage with life. They get to engage with their own bodies in the right way and actually be healthy, thriving people.
So we see a lot of families that, you know, they've got various things that are going on, and it might be anywhere from like breastfeeding problems to just the digestion and all of those kinds of things to even severe allergies. And what kinds of things are you looking for when you do your screener, your evaluation, your assessment time, and how do you pull those things together?
Well, we do work with all those things, but we're always bringing it back to the nervous system. They're really only a candidate for our care if the nervous system has been affected. Okay. But you can see, like, the nervous system literally controls everything, especially if you're talking babies and infants and younger kids. Their capacity to even breastfeed is contingent upon the rooting reflex and the sucking reflex. Can they turn their head the right way? And if there has been some stressors or trauma early in life, sometimes they just simply can't do that, or they can't do it well. And so it's all about how much has the neurology been affected? Does it correlate with what they've got going on? And that's why instead of just using the symptoms or the diagnosis that they may have been given, let's look at the raw data from the nervous system to tell us if this correlates and that if we can help, and if so, how.
Yeah. So you're kind of saying if we look at, okay, what symptoms are there and what symptoms are coming present, and then what is causing that? Is the root of that the neurological system?
Yes, because if it's not, that's not my case. That's I'm going to refer out. Yeah, if it is, it's still working on the nervous system, so those things come back online. And I will say very often it is. Like that is, you've named off some of the most common reasons we have little babies coming in: breastfeeding, colic, sleeping, digestion. Like we're working on that all day, every day. Every 5 minutes, it feels like we get good results, but we just got to make sure they're actually a candidate for care through looking at the nervous system first. And as you said, we got to think more, not symptom-based, but root cause. What's the core issue here? Because if you go symptom-based, often you'll just try to suppress the symptom. You're not actually fixing things. It's kind of more of a Band-Aid. You can give medication to like alter chemistry and shift things around, but have you actually fixed the root cause? And that's what I'm looking for, is like, are we actually reaching that part of it?
Addressing those root causes. Exactly. Yeah, I love that too. Well, and if parents have questions about that, I mean, how easy is it to just come in and have an evaluation with you guys?
It's super easy. That's the whole point of the first visit, is not to just, again, slap somebody on the table and go for it. It's to talk about things. Let's talk about your story. Let's see if it correlates to the nervous system. If people are hesitant, let's just have a conversation about things. I can sometimes steer you in the right direction to figure out like what's best for your child. We are so easily reachable on Instagram. We have a YouTube channel. We have email, super easy as well. We've even got our own podcast. I don't do it, but I'm going to call him our spokesperson. His name is Dr. Tony Ebel. He's out of Chicago. He has a podcast called Expect Miracles, and it's all about this type of chiropractic. He's on Spotify. He's all over the place as well. And so if parents have questions, that's even a good resource to actually dig super deep into this type of healthcare, because it's such a different paradigm than people are used to. And so they can get all this information and resources before they even set foot into my office. I'm happy to answer any questions. And before I take somebody on as a client, I'm just going to have a chat with them. Let's see if this makes sense. Let's see if it works. And if it's not, let's point them in the right direction too. But there's a lot of resources out there.
We'll list all of those things, like your contact information and how people can find you. And if you send us links for that other podcast, like we can link that to ours too, and see if parents can go out there and learn a little bit more and get in contact with you guys.
Yeah, we any and all questions. Just if you're curious, want to know more, we're happy if you reach out and we can chat.
I think a lot of parents will be like, well, my kid is doing this, what about this? And so to have that as a resource.
We get that all the time, and happy to answer those questions.
Oh, well, thank you for joining us today. We really appreciate it. Do you have any last minute thoughts or anything you want to leave with our listeners before we let you go?
If there's anything, it's just looking for those signs of the nervous system dysregulation. Like if you're getting these perpetual patterns of a kid can't sleep well, if digestion is off, even like emotional regulation. It doesn't have to be in the neurodivergent category. Like any kid can struggle with these things. So if you're seeing these on a recurring basis, it's possible that their nervous system is struggling a little bit. And in my perfect world, I'd actually rather catch it and prevent it as opposed to waiting until symptoms show up. So if we're ever curious about it, please reach out to us. Like even if you don't live near me, I've got a whole coalition of this type of chiropractic all over the world. I can refer anywhere, and I'm happy to do so.
Down here, go to this guy.
Exactly. And I'd love to do that. Be a concierge for people with this type of chiropractic. So I want to put that on people's mind to watch out for that for themselves and their kids, so they can just get the nervous system looked at and make sure they're okay in that way.
Yeah, it's never a good idea to just wait and see. We even say that all the time.
Yeah. We've got a few posts about that right now.
Yeah, I couldn't agree more.
Alrighty. Well, thank you again, Dr. Doug, for joining us. Like Nick said, we'll make sure everything is linked down below, and we'll send people your way if they're interested in your services and things like that. Thank you, everybody, for joining us today for this episode of Therapy Unmasked. Therapy Unmasked is brought to you by Ability Innovations and the great work that we do here. Feel free to click the link below to check out any of our resources or our free blogs and articles and videos that we provide for you each and every day. If you have any questions, feel free to reach out as well, but we will see you in the next episode of Therapy Unmasked.
Thanks for tuning in. Bye.